So let's begin the session. A very good evening to all the students who are listening to this session here. I am Dr.Sandeep Sharma, the pediatric faculty at DocTutorials. And in this special session, we have two very eminent guests with us. We have Dr. Khaleel Ahmed, the eminent radiology faculty, and we have Dr. Rahul Rajeev with us, the medicine faculty at DocTutorials. And the session is in this session, we are going to discuss the approach, the blueprint, the roadmap you should be taking in case you are targeting the NEET PG 2023 exam. Whether you are an intern or you are a medical officer who's yet to sit in the exam, or you are somebody who has sit in the previous NEET PG but hasn't got a great rank and you're looking for the way out, this session is going to help each one of you. So let me start with the session and let me welcome both my guests. So I welcome Dr. Khaleel and Dr. Rahul to the session.
Hello, sir. Good evening.
Good evening, sir, and good evening to all the listeners and all the students.
So I think students are joining in. So I'll just share my screen, and what we'll be doing in this is, just a minute, please. Yeah. So I hope the screen is visible to you. So what we'll be doing in this session is, I'll be taking some questions on behalf of students, the common queries which we all as faculty members get. These are most of these queries are there, which you might have felt at certain stage in your preparation, or you might be, grappling with right now. So we will be taking it, and we'll be taking the help of our experts here who will be telling you, who will be sharing their experience, guiding you. And in the end, we will be discussing about, it will be an open house session where we'll be taking individual queries of the students as well. So we'll be discussing the common queries here, right? We'll be discussing common queries. There will be suggestion and tips coming up, and in the end, there will be open house for live question and answer session. So let me start with, first of all, question number one. So, sir, please tell the students, will there be NEET PG or next PG in 2023?
Okay. So good evening to all students. I'm sure that this is one question which everyone has in mind. So first of all, let me tell you, actually, there shouldn't be a scenario where this question is there because actually before every exam, they should announce the exam pattern at least 1 year ahead. But unfortunately, in our scenario, there is always a delay in announcement. But as of now, what we understand is it might be NEET PG. Yes, I know that some of you would have seen the news in a particular newspaper regarding a possibility of next. But let me tell you, to all aspirants preparing for the upcoming exam, it really shouldn't matter. Because see, what you have got to do it is that assume that the exam is in Jan, prepare accordingly, because the style of preparation, even if it is next, would remain the same. Only thing is that the weightage of certain subjects might slightly tilt. So what you can probably do as of now is focus on your preparation, go ahead leading on to the possibly assuming that the exam is in Jan. And even if there are some last minute changes, you can adjust. But as of now, the government has not officially announced neither the date nor whether it is NEET PG or next. But my answer would be, as of now, just focus on the present and focus on your current preparation. Okay.
Very rightly said, sir. Khaleel, sir, you would like to add something?
Same thing, sir. I mean, unless there is an official notification, we should not panic on that. Whether it is NEET PG or next PG, the concepts remain the same, the subjects remain the same, right? And the application part, we can fine tune it once the exact notification comes in. So rather than worrying about it, we should start working on our concept building for these subjects and these exams.
Very rightly said, sir. So the next question, which a lot of students ask, and this is a question I would like to ask Khaleel sir first. Sir, if someone is going to sit in NEET PG 23 as a fresher, currently an intern, what should be the revision strategy? And in case somebody is dropping right now, Like somebody prepared for the NEET PG and he or she didn't get a good rank. So how is the revision strategy going to be different? Because the time available is going to be very different for both the candidates. Sir, any suggestions from your side?
Yes, sir. So for a fresher to start, sir, when we meet fresher students, right, there are, students who everybody soon after their final year, when they start their internship, I want the students to have a proper target, a goal, and a complete focus towards achieving it. I see students with no target in mind starting their preparation for NEET PG. They don't have any goal set in, and they are afraid of getting into the hardship of this training and the learning process, and they never end up on the positive note. And there are students who start with a motivation, following their friends, following their seniors who have qualified. They start with a good goal and a motivation, and they don't continue it, and they get panicked midway. So important to have a goal and a ambition and stick to it till the last day of the exam, till the 200th question till of the exam. That motivation is important. When you're starting fresh, have a goal and work towards it. And the how do you take this forward is first important to understand, to divide your subjects. There are some subjects which are core conceptual subjects. You can only build your other subjects if you know them. Like if you don't emphasize on your basic conceptual subject as a fresher, you will find it difficult when you go into your clinical subjects. So your pathology, your pharmacology, your anatomy should be the subjects that you try to work on in the initial phase of your preparation, and try to build the clinical subjects around it. One good strategy which fresher students I would feel can adapt easily is to work on their basic conceptual subjects like patho, pharma, anatomy, and include some short subjects which can be done independently, like Dhamma, anesthesia. They don't need a lot of other subject integration. And once this is done, once your anatomy is done, your orthopedics and your surgery becomes easier. Once your pathopharma is done, your medicine, understanding of medicine becomes easier. So having the start with a basic conceptual subjects intermixed with short subjects, then doing your clinical subjects and the high yield subjects. So if you can keep your SPM, OBG, medicine, surgery, like in the major part of your, once your initial phase of your preparation, initial phase of acclimatizing is over, once you keep your main core subjects there, that will yield you more results also. And subjects like radiology, which is a lot of integration required, you can keep it towards the end once you're done with all the other subjects. So other thing is about a dropper. So if somebody is dropping the exam and he's preparing, he already must have been exposed to all the subjects once, and he knows, right, which subjects are his key subjects and which subjects are his weak areas. So it's very important to analyze that. And the best way to analyze must be the grand test. So when you have written your grand test, you know which subjects you're doing well, which subjects you're doing poorly. Start with your weak subjects, start with your most difficult subjects first, right? First finish off on that subjects, finish off those topics, finish off those subjects, and then try to have a faster revision of the subjects that you're stronger in. Many people who drop also did not find enough time to do MCQ practice. So that is one thing that I would suggest to them, that along with their theory, also see that they increase the time for MCQ practice in their drop year. And I think any other suggestion from Rahul, sir?
No, sir, perfectly said. You have summarized all the important points. I completely agree with this.
Correct, sir. Sir, one thing I would like to add here, that people who are currently interns or, they're working somewhere, what they would sometimes feel is that we are interns, others who are sitting at home, they are getting so much of time and we are not getting so much of time. I think end of the day, what matters is how consistently people are doing their work and how many productive hours they are going to take it out. Somebody who has a lot of time is also going to waste a lot of time. That is human nature. I personally felt that in my UG days, I have been, before I got into MBBS, I had been a dropper. So I've gone through that phase. In the post-PG life, again, there was a 6-month period where I have dropped by choice because I was not getting a seat of my choice before I went into PGI. So at that time also, I felt that the more time you have, the more time you tend to waste. So if you are a dropper, or in case you have a adequate time available, Khaleel sir very rightly said, droppers tend to overdo theory. So you have to do theory, but also you have to practice the MCQs. Second thing that you need to understand is when you are having limited time, especially the interns, whatever time is available to you, try to make judicious use of it. Be selective in whatever you are reading, define your resources and revise them well. whenever there is a new thing to read, you read them at whenever you have a break in between the work. When you are working at your place, try to solve MCQs at that time, or try to revise what you have already read before. I think these small little things I would like to add. So thank you so much, sir, for the suggestions. And moving on to the next question. So again, Dr. Rahul,
Yes.
a lot of students, they have this query that they have prepared with XYZ institute material, but in NEET PG exam, they could not do well. So they are always in a dilemma. Should I join a face-to-face class again, or should I join a test and discussion and be avoid a face-to-face class, or should I go for a new online platform? So, sir, what is your take on this?
Okay, so first of all, addressing the query online versus offline. See, if you are able to give yourself a good self-imposed discipline, then I think you're perfectly fine with going ahead with online as a sole source. That is, if you are able to give yourself a good discipline. Now, in case you want, say, a classroom atmosphere also to stay disciplined, then I think the offline would be a better choice. But even if it is an offline, you can have an additional backup of an online platform. Say, suppose you are weak in certain subjects, like say pathology, medicine, so slightly vast subjects, you want to just listen to the lecture once again, you can have an added backup online platform as well. Now, face-to-face, regular course or test and discussion. Now, for this query, first of all, try to see why you could not crack this time. If you have already made good notes and the problem was lack of enough MCQ practice, then I think test and discussion would be fine. But if your preparation during the previous attempt was haphazard, or you have not made good notes of many of these subjects, in that case, it is better to go for a regular course. So in that case, you start off with regular course and then practice MCQs as well. But let me tell you, one basic point I want to stress here is always give some time for a self-analysis. Why you could not crack in this attempt? Was it because you did not attend lectures? Or was it because you skipped certain subjects or certain topics? Was it because you could not memorize? Was it because you could not do much of test, especially grand test? So whether it was lacking the exam practice, so just identify what went wrong so that you can correct it rather than repeating the same mistake again. So please do a self-analysis before you make the next step forward. Yes, sir. That's what I want to say about that.
Very rightly said, sir. Khaleel, sir, you would like to add something here?
I think, today's both of them are equally important. So, the most successful model I would feel is a hybrid model. Everybody should, adapt to that model. And as rightly said, if you're a person who is very, very self-disciplined, who wakes up and does not study on the bed, right, goes onto his study table, has a calm atmosphere in the home where he can focus completely, an online platform is, is a very good, intensive, and you will have all the solutions that is needed. But if you're a person who likes to be in the atmosphere where you are all like-minded people are actually sitting and working with the same goal, right, having a live face-to-face interaction with your faculty, that should be good. So, and lack of self-discipline, face-to-face class is much better. And going for TND is sufficient or not, if you have already done well and if you're coming very close to the marks, very good scores, but you're not able to get your seat of choice, in such people whose concepts are really strong, just to see that they are in a time frame so that they can schedule their tests in such a fashion that they finish the syllabus and then attend the test, subject-wise test will help those students who have actually done very good in their exam but not good enough to get their seats. So TND is only for those people, I feel. Otherwise, if the scores are low or if the concepts are not good, going for a full-fledged course again is ideal, sir.
Rightly said, sir. Sir, one point I'd like to add here, because all the suggestions are there, like they have been given by by us also, and you must be talking to your contemporaries, your peers, your seniors also who have got selected in the exam. You need to understand and ask the question yourself, where do I stand and what exactly suits me? Because what works for person A may not work for person B. Like Rishabh Pant has a style of playing. He cannot play like Chiteshwar Pujara and vice versa. So you need to understand what is your deficiency, where you are lacking, and rather than going by what your friends are doing or what others are suggesting, you take the decision yourself. And trust me, if you do a self-analysis even for half a day and take this call based upon the points told by Dr. Rahul Rajeev, I think you would not repent the decision you take of joining any course. End of the day, a course can only guide you. It is your own preparation that is going to help you. So thank you so much, sir. And again, Khaleel sir, this is a very common query we get. In fact, you and I were talking about it also some days back. So students often say, sir, not yet finished syllabus even once. How to fasten up my preparation and how many revisions will be needed? Because there are certain toppers who give interviews and they say I did 7-8 revisions. There are some people who say 1 to 2 good revisions are enough. Sir, what is your take on this?
Yeah. Sir, finishing all 19 subjects is a must. I would say it is a rule. You cannot enter an examination hall without completing 19 subjects. And if time is a factor, if you're not able to do that, especially with 200 questions exam pattern with integrated questions, your clinical subject should be on your tips. If you want, if you are not finding time to complete them, at least the subjects that you are not very well through, please try to do a retrograde study, do the previous year questions, try to combine it with some high yield topics, but do all 19. Doing all 19 subjects is a rule. You cannot enter the examination hall and expect a good rank without doing that part. And it is pretty much possible. We are still in July, right? It is pretty much possible to complete all the 19 subjects if you're really, really strongly motivated to get it done. And how many revisions? As many as possible. But don't delay your revisions till the completion of your course. I would not suggest somebody to finish off and then start his revision in October or November. Do it every month. Do it as frequently as possible. Don't look for a ideal revision, right? There is nothing called as a perfect revision plan or something. Do more revisions. I would suggest after every subject, after every day also, before you sleep, you should revise whatever you studied the same day. Before you move to the next subject, see that you revise the subject that you have put in effort for the last 4 to 5 days. Before each month grand test that you're going to attempt, try to see that you cover up at least few subjects of that grand test in a revision part. So looking for a more revision and adding revisions into your study plans rather than waiting for the entire syllabus to be over then doing the revision is to be planned in a way that more revisions are done, and that will increase your scores in your GTs also. And the more revisions you do, obviously the more confidence and less errors you will have in the exam.
Very well said, sir. Dr. Rahul, you would like to add something here?
No, sir. Perfect.
Perfect. Great. So Dr. Rahul, now this is a very controversial thing I'm going to ask you here. And what you will find is these days, every few years, there is always a thing which becomes so-called trending in the exam. So these days, first aid is trending these days. Like it's being sold, it's being told as, you do first aid, you will get a top rank in NEET PG and INI-CET exam. There are certain students who message us. I know that you also must be getting certain messages that they have never read it. So should they leave everything and start reading first aid, or should they stick to their own notes, or should they be doing it selectively? Sir, what is your take on this?
Yes, sir. So basically, I will never say that this is an indispensable tool, because I still feel your own made notes are the ones most important. But why do certain candidates prefer first aid, or they say that, okay, this helped, is because first aid as a tool, it might be easier to revise. Okay, so because the subjects that we have to cover, the portions are vast. So the last few weeks, say last 3 weeks of leading to the exam, you want to revise your content. So some students might say, okay, first aid is easier to revise. But my take is, if you are someone who can make your own small diary, where you can write down the core points that you're likely to forget, which you want to revise just a couple of weeks before the exam, that is the ideal one. That is what I feel. Okay. On the other hand, if you are a bit more lazy and you don't want to make such books, in that case, maybe. But otherwise, I think stick to your notes. Don't have this, fear of missing out. That, okay, is this some book that I should read? And if I don't read that, will I miss any points? Nothing like that. The only thing is that it might be easier to revise, but always self-made notes and a small diary where I think you should make it a habit while you revise, so while you study a topic, say cardiology. You might not be able to read, say, cover to cover of your cardiology notes just a week prior to the exam. So suppose you are a bit weak in ECG, the important highlighting features, how to differentiate the various arrhythmias, the treatment, you can write in a small chit book. So I think that book that you make will be, I think, multiple times beneficial than a first aid. So it's not an indispensable tool. Okay. Yes.
Very rightly said, sir. Khalil, sir, your any comment on this?
I'm actually pro first aid, sir. Look, what I personally feel is first aid is a very good compilation of the review subjects. So once you have done your subject, like for example, you have done your biochemistry from your class notes, from your lecture notes, just having a quick glance at the first aid is not harmful, and it will help you, revise all the things and gives you that psychological benefit that also we have done. But don't do it like a complete book separately. Do it along with the subject, make it part of your subject-wise revision before your subject-wise test, and complete off at that time only. And it's a good book, and but not, as sir said, not at the cost of your primary preparation source. Okay, it's not that you just do the first aid and try to feel that you can let go of your primary subject. No, do your subject thoroughly with your class notes, and then if you at the time of revision just have a glance of the first aid part, if you feel like to see how it is compiled and what are the high yield areas that you might not have stressed on, and then go back to your subject wise test and subject wise questions.
Rightly said, sir. See, end of the day, again, my personal opinion is first aid is a very good book. And especially there are parts of biochemistry. Sir has also talked about biochemistry, the vitamin deficiencies and the tables related to them. Quick revision of biochemistry, quick revision of certain tables in pathology, medicine. I think first aid can be really helpful in that. But do not think that you will do first aid alone and you will neglect your routine notes, routine classes, and you will get through. First aid will help in elevating your score, but end of the day, it needs to be integrated in whatever things you are doing. If you are already making your own notes, the so-called 20th notebook, certain people make 20th notebook where it has all the important points mentioned alongside. We'll not be going into details of that. So if you're making your own note, then first aid is not essential, but end of the day, it is a good revision tool, no doubt about it. But it is not, again, not at the cost of your own notes. So, sir, Khalil sir, why so many people stress on preparing for integrated clinical MCQs? Radiology is probably the subject in which maximum integrated questions are asked. So, sir, you are the best person to guide students about it.
Sir, when they are studying the subjects, integrated clinical MCQs today are the norm in 200 marks questions, right? There are a lot of questions that are overlapping with anatomy, surgery, radiology, and when you're studying the subject well, right, you already know the answers, right? You don't have to get unnecessary panic about term called as integrated. Obviously, when you're studying, obviously we are integrating. Unless you know your anatomy or ortho, you will not understand. Unless you know your anatomy or surgery, you will not understand. And the questions are the integrated questions. What I have felt is they're only testing most important concepts only, sir. The integrated questions are not on randomly picked up topics. They're on the core topics, the core conceptual topics, which every medical student has to study in detail, like the pneumothorax, the pneumoperitoneum, like the bleeds that we have. So very, very standard questions are only integrated. Like they give you a lot of clinical scenario in surgery and then give a radiograph showing the air under diaphragm. So it is not something randomly picked up and integrated question. It is a core conceptual question. So this fear is unnecessary, right? What we are studying as a medical student obviously has a lot of clinical application, obviously has a clinical integration. And you can practice even in DocTutorials app. We have this system wise integrated schedule now. Even I think it's going on ongoing. We have done the CVS recently, now CNS is going on. So this actually we are trying to see that all the questions of all the systems are being covered in integrated fashion. Practicing these questions will give you that confidence, will give you that early analysis. And the thing is to be able to pick up the keywords when you're doing the integrated MCQs. Do them once you're done your subject thoroughly, and don't wait for all the 19 subjects to be covered to start doing integrated questions. If you're done your medicine, start doing the integrated questions in medicine, because it's not going to be a so randomly asked topic. Do the integrated questions simultaneously. Once you come to radiology, obviously the understanding of the radiographs, understanding of CT and MRI becomes much easier, but don't postpone to do your integrated questions till the last. And any other suggestions, sir? Rahul, sir?
So definitely, this time we have done a lot of integrated videos in the DocTutorials app as well. So I would urge the students to go through them, because you will get a feel, okay, how two subjects can be integrated. And we have done multiple such videos. And when you watch that videos, you will understand that we are trying to make it more simple for you and not complicated. I think even certain, and we have just focused on core topics. It's not like we have just tried to integrate on any random topic. What all topics have high probability of being asked, we have focused on those topics, and the integrated discussions will revolve around that. And I think, if you watch the full set of videos, I think you will have a good level of confidence dealing with such questions as well.
I think we have done enough number of integrated videos, sir. Like, different integration. I still remember doing it with surgery and pathology and medicine and pediatrics. I think those video lectures are really good. And along with that, they should practice the system-wise integrated questions, sir. I mean, I think this combination that is there in doctorals for the system, for the integrated question, that should solve most of the issue with the integrated questions.
Yes.
Rightly said, sir. So students, you can have a look at the in the coming days also. We will be posting some sample videos, and there are already some of the sample videos. You can have a look at the app, and you can have a look at the type of questions. Even if you eventually decide not to subscribe to DocTutorials, it is fine. The point here is you should see how integrated questions need to be approached. Only when you have seen, you would realize that, okay, this is the way it is being approached. This is the way I am going to inculcate in my practice.
The videos are MCQ based, right? The integrated videos that we have done, most of them are actually MCQ based only.
So what actually we have taken an MCQ, and 2 or 3 faculties are sitting, and they have threadbare discussed it out. So their corresponding things and how the things come together and what way that particular thing or particular question can be asked, we have discussed in that format. So I think even when you are reading yourself, in case you have the subject, all 19 subjects in front of you, all notes in front of you, you can also do reading in based upon the way we have discussed in our videos. Right, sir. Now, the importance of grand tests, when to give, how many to give, the evergreen question. Rahul, sir, you would like to say something on this? Because I am very passionate about this thing. First, you say something, then I write to it.
Yeah, basically the first point I want to tell is all the students is that tomorrow is the best day to start giving a grand test. There is no point delaying. Okay, or maybe even today is the best day to give the grand test, because what I want to tell you is, do not wait to finish all the subjects and then start writing grand test. You might ask me, why, sir? I'm done only with say 60% or maybe 40%. See, when you write your first grand test, I think then you will get a realization where you stand. Now, it's a totally different feeling writing a subject-wise test and a grand test. So the first grand test you give, gives you a feeling, okay, this is probably where I stand. Okay, these are my very weak subjects and I have to work on that. You will get an idea on the overall distribution of questions. And that realization is important, because when you learn from there, even when you study topics, I think your perspective of focusing on topics will actually change when you give grand tests. Because I feel if you just study and give subject-wise test alone, writing the exam of the same topic that you learn puts you into a comfort zone. But you have to give grand test early. And regarding number of grand tests, see, to begin with, in the initial couple of months, at least 1 grand test per month to begin with. And then, you can actually make it to 2 or maybe 3. That again depends on your level of preparation. This might not be same for everyone, but the bottom line here is grand tests are important. It is a very, very important self-assessment tool. And, when you go forward with your grand test, you will see your score, picking up also, because then you are able to track your graph, because you have to have a reference point, right? When you begin your preparation, I think the first GT that you give is your reference point. The second GT you give, okay, there is an improvement by say 8 questions. The third GT that you give. So you will be able to plot a graph and you will be able to see if your progress is in the right direction. Now, so don't assess yourself or judge yourself just based on the marks of the initial grand test, because all exams are not to judge. It is again a progress tool as well. And I think, that is how you have got to see grand test. So Sandeep sir, your suggestions on grand test.
Sir, my suggestions are very clear. Like whenever somebody asks me in person, sir, I have been preparing for 6 months and I have not given a grand test. There is a dialogue in the movie Gangs of Wasipur where the lady says, "Tera khoon khab kholega, Faisal." So the same question I ask him, "Ki kab karoge bhai? When are you going to do it?" You have to do grand test. See, you cannot escape. You cannot keep on reading theory again and again and again, and then give a subject-wise test after that. Immediately you read cystic fibrosis, you solve questions, 9 out of 10 you will be able to solve. But if you read the entire pulmonology of medicine and pediatrics and then you give the exam, you will find that your score will be actually reflective of where you stand. And you may not even be able to solve even 50% of the cystic fibrosis questions, telling you that you need to read better. It's a reality check. It is better to have a reality check before the exam rather than to have it in the exam. So before you can do something about it, after that, you will again be listening to us talking about strategy 6 months from now. Don't let that thing come in. A very important thing is grand test, and it is seen that people who are consistently doing good in grand test, they do get selected. They may be a topper, they may not be a topper, but they do get selected and they do get a rank of your choice, the branch of your choice when the actual exam comes. So start giving grand test. The points, do not wait for the ideal time to come. Even if you have done 3 or 4 subjects, suppose you are doing 3 subjects, you have done medicine, pharmacology, and anatomy. Give the grand test. Whatever score you get, that is your baseline score. Then after 1 month, you will be giving another test. You would have done 2 more subjects or 3 more subjects by that time. So your score should be increasing somewhere around 7 to 10%. If it is rising more than that, excellent. At least 7 to 10%, you're doing fine. If your score is still static, it means the subjects you have done or the subjects you are doing, your quality, your accuracy is lacking. So they will tell you to do course correction, ask for help, change your material, change the track, but get the course corrected. So I think grand test is one of the most important thing, more important than theory, I would say, along with your preparation. And this is something even interns should be focusing upon, at least one grand test every month. So from the grand test, let us move further. Sir, this is again a common thing. These days, there is not a positive material, there is a excess of material. So students would say, I cannot remain focused, sir. Every time a new course or video or book launches, or every time a YouTube influencer or Instagram influencer comes up with a smart, miraculous plan to crack exam in the next 1 month, I feel like following that, reading that, and leaving the thing which I was doing. How to manage this FOMO? Sir, your take on this.
My personal opinion is, first thing is trust your resources, trust your teachers. Most of the content today, okay, every good teacher that you are following tries to see that do justice to their students. So trust your teachers. First thing, unless you trust it, you'll not come. Your teachers will guide you through the most high yield content, the most expected questions that are coming in. And if that is the case, we should all start reading Grey's Anatomy then, right from the first year subject. If that is a case of fear of missing out, it is not possible. And it is not about intensive work that we have to do. We have to focus on a high yield content, and trust your resource for giving you that thing. And your exam results will be based on the commonly tested, routinely tested. If you don't do mistakes in your commonly tested, routinely tested, you will have your rank, you will have your seat. First, get that thoroughly done. Only then worry about some rare topics or some random topics. So very, very important to understand is trusting your source that you have taken up. Do it well. Don't miss out on the commonly done topics, and don't worry about rare topics that you will learn as you go through when you do your subject-wise questions, grand test, and PYQs. All those rare topics that you have to come across, you'll come across. Keep adding in your primary notes. But it is not that. It's not about the content. It is about the commitment that you have now. Okay, don't go behind content. Go with commitment that whatever you have in your hand, are you well versed with it? Are you not doing errors in it? And it is, if you see the question paper and in the retrograde, when you see the paper, it is all relevant topics. Hardly few percentage of questions, hardly I feel 20-30 questions would be something that would be very different. But most of the topics are doable. Most of the topics are the commonly asked questions. So Rahul, sir, your view on this?
Perfect, sir. When you go from one resource to another, rather than making things simple, I think it makes it more complex. So as sir said, trust your resource. And suppose, if you take one resource, any platform, it would have everything, the lectures, the Q bank, the test series, grand test. So please don't jump from one, resource to another. Try to stick to your resource, and just only you have got to track your progress. Like if you're attempting in, suppose, DocTutorials, just see, okay, how am I faring last month versus this month, last month grand test versus this month. So just focus on your resource and trust your resource.
Thank you, sir. Very rightly said. So end of the day, there will be a lot of things in the market. It's like going to a buffet. You go to a buffet, there are a lot of things there. You eat what you feel you can digest. And the same is true for the materials, the various courses which are available. End of the day, no course, no book, no teacher is good or bad. If you stick to one area and focus on it and do it thoroughly, give grand tests, revise it multiple number of times, you are indeed going to get selected. But if you keep on jumping from one place to another, one course to another, just because somebody else is saying something, that is going to be problematic. So pick one course and then stick as if your life depends upon it. So, sir, the next query which we often get from students again is a common one. How much time we should be devoting to big subjects like medicine, surgery, and OBG, to medium subjects like anatomy, physiology, ENT, ophthalmology, pediatrics, microbiology, and short subjects like radiology, ophthalmology, orthopedics, etc. So in first reading and revision, some basic idea if you can give, sir.
Okay. So first of all, the answer to this question depends on how many months are left for your exam. Now let us assume that the exam is on Jan. So suppose if you have 6 months left, then you have to strategize your timetable accordingly. Now remember, the time that you want to devote to a particular subject should depend mainly on two factors. One, the proportion of questions that usually come in any standard exam from that particular subject. And number two, how difficult is that subject for you? For example, biochemistry may be a difficult subject for me. I might find it difficult to memorize the enzymes. It might be easy for another person. So always identify your weak subjects as well. And when you devote time for, say, the big subjects or maybe short subjects, always just keep in mind the time available. Because see, if you take a small subject like a psychiatry, you cannot spend, say, 12 full days to study psychiatry. And because if you want to have 12 days, you can spread out by 12 days. The thing is, every subject is vast. Actually, there is no such short subject, because even a subject like psychiatry also you can do vast reading. But remember, you are not attempting an MD psychiatry exam. You are writing a postgraduate entrance exam. So give weightage to the subject based on the proportion of questions asked. And so for topics like medicine, okay, this is a subject from which you are likely to get good number of questions. So schedule your time accordingly. And suppose if you are weak in cardiovascular system, what you can do is you can spend a bit more in that. So just try to identify your weak areas. Now you should do this before you start say preparing itself. Preparing means going ahead far into your preparation, because if you don't do that, then what will happen is that, suppose if I am not very strong in PSM and I'm not good in medicine, then if you keep these subjects towards the end, then the pressure starts building up. So what I want to tell you is, have clarity on your weak subjects. Try to spend more time for that. And one thing I want to tell you, this is very, very important. Rather than taking so much time to read a particular subject, it is always ideal if you have multiple revisions. How many revisions? I think a bare minimum of 2 revisions. But if you can have one more extra month of revision, I think if I say a revision cycle to be 30 days, then 2 cycles I feel is bare minimum. There are candidates who go with 1 revision also. Obviously differs between candidates, but I would say a minimum of 2. And but always remember, looking at your notes multiple times always helps, because In the exam, you are likely to have, at least many of you, photographic memory of your notes, and you're likely to retain that for your exam as well. So always the point here is devote time according to the weightage of the subject and also according to which topic or subject you are weak at. Yes.
Khaleel sir, you would like to add something, sir?
Yeah, so because this is, the first reading, and if the students have time with them, they are in their final year, they are started from their third year, doing an extensive reading of that subject during their course is fine. But once they are in the NEET PG preparation, they have to very, very sharply categorize which subjects they want to spend more time with and which subjects in the short duration. So short subjects, if they are in the final year, they can have enough time. They can spend 10, 12 days for the short subjects. That is fine if they are in their, third final year or the third year. But doing it during NEET PG preparation so many days is not advisable. You use it first you have to see that, every subject timeline, you have to fix it and try to limit it to that thing. If some topics you're not able to do it, plan it in a retrograde fashion. Some subjects you're not able to complete, plan it in a retrograde fashion. But you cannot retrograde, I mean doing all the high yield areas and previous year questions and high yield topics, rather than trying to do it cover to cover. So you can take that chance based on the time duration that you have with each of that subject. But if there is a student who is just in his third year, final year, and who has time for his exam, he should do it thoroughly so that the understanding of the subject becomes easier. And during the time of NEET PG preparation, he can use it as a fast tool for revision. And there are some quick revision videos also available, right? So, I mean, we have done in the app for every subject. So if at all you feel that you're not able to complete a subject in the time duration, right, you can always take the help. Most of the faculties have tried to concise that whole subject as much as possible into a brief program that will help you do that subject. Don't leave a subject. Try to use quick revision programs and try to complete that subject.
Very rightly said, sir. Just to add one small little advice, like there is a thing I'm very fond of fancy words. So there is a thing I call as 50% rule. Actually, it's been devised by somebody else. But 50% rule basically means, suppose if you have 6 months to go, right? And apply the 50% rule. So your one complete reading of 19 subjects should be done in 3 months, right? The next revision should be done in 50% of that. That is 1.5 months, you should do another revision. And then try to squeeze in 1 or 2 quick revisions in the remaining time. This will come down to 2 to 3 quick revisions, as Dr. Rahul was talking about. And trust me, it works. It really works well. But when you break it down, you will find that for subjects like psychiatry or dermatology, you will be getting only 1 day per subject in the first reading and half a day per subject in the subsequent readings. That's fine. End of the day, medicine will always have more weightage. So you need to give importance to medicine more than you will be giving to psychiatry or dermatology. Having said that, if you don't read psychiatry or dermatology, there is also an unsaid rule, nature's rule. The subject, the topic which you leave is the topic which always gets asked in the exam. I don't know about you, that has been the case throughout my life. So do not leave anything to chance. At least cover the subjects properly. And as Khaleel sir rightly said, if you cannot read it cover to cover, if you cannot read it properly, at least go through the recent questions, related theory from any source which helps you in quick revision. We have a DocTutorials quick revision program. You have any other resource or you have your own quick revision, key pointers, written notes, some 20th notebook, go with it. But do not leave any subject. Number of revision is more important, as Rahul sir said, than the quality of revision that you are doing. Now, sir, this is again, I like to have your view on this. Just 2 days back itself, I got a lot of questions on this. I have a rank in NEET PG 22, but I may not get a MD seat of my choice. Should I join DNB or compromise my MD MS branch or take a drop? Now, there are a lot of students who will be getting, good ranks, but they may not be able to get, say, MD radio diagnosis or MD medicine or MD pediatrics. So now they are in a dilemma. Should we compromise a branch? Should we go towards DNB? Should we take a drop? Sir, your take on this.
Okay, so this is a common query that is asked by students. So first of all, I want to tell you that see, MD versus DNB, there are many DNB colleges which are at par or maybe even better than the MD colleges. So if your aim in life is a private practice, so in that case, it is even DNB at most of the hospitals is almost considered equivalent to MD. The only thing is that one of the factors is if you want to get into a teaching job in a teaching hospital, then you will have to consider. That is one point. Second is it is that tag, years back, everyone used to feel, okay, DNB is inferior, and many people used to think that DNB is diploma. Please understand, DNB is not diploma. So DNB is actually, as I said, it is quite different from diploma. And when it comes to, say, a working environment in majority of the hospitals, you are at actually par with the MD person. And suppose in case of my branch, medicine, see, when I did my super specialty, some of my colleagues actually have taken DNB medicine, and then they go on to take super specialty. At the end of the day, both of us have done DM neurology from a particular institute. So please remember, in many colleges, DNB is equivalent, or maybe, is as good as, MD colleges. But always remember, just don't take DNB just for the sake of the branch. If you're getting DNB only in a hospital where exposure is not that good, and say in my subject, medicine, there is no ICU facility available, in that case, please don't take it just for the sake, okay, this is medicine. Okay, so that is what I want to emphasize. But always remember, if you're taking DNB, please take it in a good institute. Okay.
Sir, your take on this, Khaleel sir?
Yeah. Sir, I personally feel, sir, getting a DNB of your choice in a good college is better than going for an MD or an MS of a subject that you are not very inclined towards. So if you're getting a DNB of your, like DNB radiology, so there are good institutes which, as sir mentioned, are much better than even your MD training institutes, where you can get all the exposure of all the modalities. And these corporate hospitals have a lot of new MRI, CTs and stuff. So if you are interested in a branch, right, and you're getting it in a good college setting, it is always better rather than changing into a subject for a sake of an MD or MS, which you're not inclined towards.
Correct, sir. Just to add to whatever we have discussed so far about taking a drop, that is a very, very tricky decision and a dangerous decision. And there are no corrects. There is no absolute right or wrong here. Just like life is not black or white, there are always shades of gray. So similarly here also, in case you are a dropper, in case you have given, say, example, you have given 2 or 3 attempts and you have given your best shot, or you are having serious financial issues and you cannot take further drop, then it makes sense for you to get the best seat that you are getting. When I say a best seat at your rank, it means it should be closer to the subject that you wanted to do. And even if you're getting DNB, it is fine. See, the passing rate of DNB is less. Exit exam is always an issue, but end of the day, people do pass DNB. And dropping now for 1 year, you're not even sure that you are going to get the same rank that you got now. So it is a very dangerous thing when you consider dropping. On the other hand, suppose you take up DNB in a not so good institute, but you're doing a branch of your choice, and God forbid you do not do well in your exit exam. Maximum what will happen? For 6 months, you will be working at some place in your branch, and people do get paid in corporates for that. And afterwards, you will be taking the exam. And most of the students, unless you're really having serious issues with your preparation or with your luck, people do tend to, cross it within 6 months or 1 year at the most. There are very few people who are stuck in the limbo. So that is why probability wise, it is always better if you are going to take a drop, think twice, you may or may not get a rank again. In case you feel that you are a fresher and you have still a lot of, firepower left in you, it was not your best shot, and you are willing to take that risk that you may not even get this rank which you got the last time, then you should go in for dropping. But this should be a considered decision, knowing fully well you may or may not get the same rank again. Sir, Khaleel sir, score in GT is not rising. What to do? Very commonly asked question.
Yeah, I think in the initial couple of GTs, it will remain like that. So do not get panicked when you are just starting up with your GTs. The initial 2-3 GTs, you will feel that your scores are pretty much similar. But if there is no change even after that, then you have to sit down and analyze that you are not doing your GTs, or you're not analyzing your GTs the way it has to be done. always after each GT, you note down which subjects and which topics you have not done well, or where did the errors go into, right? And see that you strengthen those areas. If your analysis of your GTs is not good, and then you're not working on them, obviously they're going to remain static. So it is very important that after each GT, for initial couple of GTs, it will be same. But after each GT, you sit down and understand the whole purpose of a GT is to see where your weak areas are, where your weak topics are, and work on them. And you will definitely start to see that change happening in the long term. But if you keep on just doing GT just for the sake of GT and just leaving the answer key and moving forward for the next month and or the next GT without actually putting efforts to strengthen your weak areas, that is where the staticness or the GTs remain constant there. So it's important that you analyze your GT thoroughly, spend enough time, understand which subjects you need to do, and try working on those subjects. After each GT, you should strengthen a couple of subjects after each GT, the ones which you are scoring the least or the ones you have been most volatile on.
Yeah, I completely agree with Khaleel sir. Just one point to add. See, this is a question that many students ask. Sir, I am stuck up in this particular score for my GTs. What am I supposed to do? So the answer to this question again differs between students, because as Khaleel sir said, do a self-analysis. And once you do the analysis, if you find, okay, if you look at the mistakes that you have made, okay, I have made say around 20 questions wrong, which were actually from my notes. In that case, the problem is either with your reading or maybe your revision. So you have got to work on that. At the same time, and also maybe your MCQ practice as well. And because some students, they might have studied a topic, but when it comes to the question, they are not able to apply it well. For that, for the application problem, the best solution is practicing more MCQs. At the same time, if you still feel, okay, I have not got many questions, which actually is not there in my notes. So just check whether you have actually had made a good collection of notes or made a good notes yourself. And sometimes, you might have just joined for a TND course. You might not have a good collection of notes. So in that case, you have to analyze, okay, should I go for, some online course or maybe, join a face-to-face? Is my notes lacking? So basically the bottom line is, you try to analyze yourself why your score in GT is not rising after the exam by analyzing your mistakes. Okay, that's important.
Great, sir. So I think to summarize, I think to increase the score in GT, as Khaleel sir said, you should be analyzing your weaknesses. Then you should be seeing, as Rahul sir said, whether your materials are adequate or not. And then you should be doing MCQ practice in between the GTs. Whatever subject you are reading, you will be giving, you should be solving some subject wise test. You will sometimes be solving a Q bank. Sometimes you will be solving past year papers. The more number of MCQs you solve, the better your theory retention becomes, and automatically your GT score starts rising. So the next question again, this goes to Dr. Rahul. Sir, how can the same topper be the student of so many institutes? See, frankly, sir, it is not related to our discussion per se, but we keep getting this kind of thing. And there are some important messages here for certain students. Sir, your take on this, sir.
So basically, this is a very important question, because many students message me, sir, should I subscribe to multiple platforms? Because I see that toppers are from multiple platforms. See, what I want you to understand is, see, certain students who have been doing very well from their MBBS days, what they might be doing is, okay, they have subscribed to X platform, and when they feel that, okay, certain subjects, okay, these two subjects I just want to do from an alternate platform, they might subscribe to alternate platform. So, and even there might be some toppers, but a very small fraction of them who would want to listen to a same subject from two faculties. But let me tell you, my personal view is that is not required. But especially if you are, say, starting your preparation now and the time remaining is limited, I don't think there is any need to rely on multiple resources. And I say this because at least many students will feel, okay, 6 months, should I subscribe to platforms? Just trust your resource, because we have already highlighted that point in one of the earlier questions also. Stick to your resource, trust your faculties, and do justice to the time that you have. So if you just randomly go at multiple platforms, thinking that, okay, joining multiple platforms is going to fetch me a good score, that is not the case. Yeah, so that is what I want to tell you.
Khaleel sir, your take on this?
I also, agree completely with Rahul. So what I feel is, when you're doing your questions, when you're doing your GTs, you will know whether your content or whether your material is sufficient or not. When you're solving a subject and you see a lot of new questions which you have never heard of, obviously the content or the material that you're doing is not up to the mark. But if the content is something that you have studied, only your application is getting, missed out on. You're doing the error because you did not apply the concepts, the theory well. Need not change your resources and all. Just see that you practice more questions, so those errors keep becoming lesser and lesser with time. Yes.
Right, sir. End of the day, you need to understand that if there is a topper, it is all obviously a human nature, and it's legally valid also, because if somebody has benefited from a multiple place and multiple things they have considered, it does not mean that the same student has read entire material from all the 6 or 7 coaching institutes which are there. It simply means that one institute, maybe he was a foundation batch student, he or she was a foundation batch student at one place, then did a crash course from other place, then was watching videos from other place and also giving tests at other place. Many people do it, especially people who are getting good numbers, good, people who are getting very good scores. They sometimes fall into the habit that they start feeling that I am getting too good a score. Is it because I am sticking to only one place? And just to change their pattern of giving GTs, etc., they tend to change the institute where they are giving the exam. So end of the day, you should not be getting swayed by the same person being a student of so many places. 1 or 2 institutes, whatever place you find, that is good enough. Even if you are preparing yourself, end of the day, institutes can only give you material, they can only guide you. The same Harrison is read by all the different people, all the 2 lakh people sitting in the exam. Some people read it thoroughly, some people only put it in their shelf books, some people do read and understand it. And that is where actually the difference lies. How you make use of the resources is more important. Sir, moving forward, before NEET PG, you will have INI CET in November coming up. So students will now automatically ask, especially those who are eligible, how different is the preparation of NEET PG from INI CET?
So basically, I think that, see, many years back, the pattern of questions of a NEET PG exam was drastically different from a Central Institute exam. But now if you see, the question patterns are more or less matching and there is no significant difference. However, there are certain topics which are more likely to be asked in INI CET exam. And how can you identify the topics? Well, just go through the recent previous year question papers. So we have made available the INI CET recent exam question discussions in the DocTutorials app. So just go through these videos and you will understand, okay, these are certain topics which are have a high likelihood of being asked in the Central Institute exams. But, in a way, the current batch of students are lucky because the questions of NEET PG and INI CET are more or less parallel, because years back, we used to have NEET PG, AIMS, PGI, a very different paper, JIPMER, which used to focus on so much of genetics related questions. But one advantage that you have is it is almost parallel, but certain core topics which are having a high likelihood of being asked in INI CET, you will get when you go through the previous year's questions. But I think it's very important for every student to go through the last 3 years question papers. Now, don't just start learning the last 10-year question papers. So just take last 3 years question papers and then see the pattern of questions. And this will give you an overall idea, okay, what sort of questions are being asked. Just one point to add. See, there is always an element of unpredictability in any entrance exam that you write. Because if you compare the previous 2 INI CET exams, you will find that in one of the exams, you had good number of clinical case-based scenario questions. In one, it was relatively less. So there is always an unpredictability. But what is the best solution for that is stick to your basics, because once your basics are thorough and you do enough MCQ practice, I think you will be able to adjust to the range of questions. Because even if they ask some basic factual questions, you will be able to answer. And even if it is a clinical scenario questions, you will be able to answer. Now, don't worry too much about the outliers which are being asked in a, say, a NEET PG or INICT. Because if you go through the INICT question papers, you might find one question being asked on the stages of, say, iron toxicity. Now, see, that was for the first time, that particular question is being asked in a entrance exam. So just seeing one outlier question, don't think like, okay, I should read more extensively about these topics and I should actually go for a 360-degree coverage of medicine. It's virtually not possible. So always keep in mind the probability. Remember, you are attending an exam with 19 subjects. So your preparation has to be focused, keeping in mind your time limitations as well. Okay.
Khaleel sir, anything
Yes.
you add, sir?
As very rightly said, your major focus preparation should be NEET PG, and you should revise your INA set papers and understand some favorite topics that INA set exams usually asks on, and don't go for the outliners as sir mentioned. If you see the toppers also, most of the NEET PG toppers are also getting good scores in the INA set, so the preparation strategy should be the same, and you should just rely on your instincts and go ahead and make INA set as your primary revision program, so that before your INA set, see that you complete one revision. So all of you should plan to write INA set, should not be trying to avoid it. For whatever sake, it will help you speeden up your revision and take it as a landmark that or a timeline that I will finish my revision of 19 subjects before I enter into INA set, and then you have another revision before your NEET PG. And the preparation strategy, pretty much as Rahul also summarized, focus on your NEET PG preparation and do last 3 to 5 years INA set papers, and do some topics that are routinely asked in INSET, and be careful with the rare topics that are asked in INSET. Do not fall in trap of that extensive reading in every subject. As sir mentioned, even in radiology, we had questions on pyrads, tirads and stuff. If you go into all of those details, missing out on the core topics, so it becomes misdirected preparation.
Very rightly said, sir. So to summarize, you have to give INICET exam. Preparation should be according to NEET PG, because the NEET PG INICET topics tend to overlap, but doing past INICET papers, especially the commonly asked questions. For example, Dye-George syndrome has been asked in recent INICET paper also. It has been asked in NEET PG exam also. So if you had read the previous INICET paper and read the topic inside out, your NEET PG question would have been correct as well. But at the same time, there are certain rare, extremely rare things which are asked in INICET. As Khaleel sir said, you should not be wasting your time in case you are targeting NEET PG. Still, if you are not convinced, still if you are not prepared, you should still give INICET, because say to yourself, it is one grand test, a glorified grand test which I'm giving. The simple reason is, when you actually sit in the exam, the kind of exposure, the kind of preparation you are going to do, and the kind of real life feel you are going to get, you will understand your strength and weakness way better. And when you sit in the NEET PG exam 2 or 3 months later, you will be in a much better position to work upon your weaknesses, which you realized in the previous exam. So INICET, preparation, no preparation, you have to give. Preparation wise, slightly different based upon the weightage and past year topics. Khaleel sir, if I'm a student and I don't like or understand a certain subject, should I leave it and save time and utilize that time by making another subject more, bulky, more strong for myself, or should it be a balanced preparation?
Khaleel sir, I think you're muted. Khaleel sir.
Khaleel sir, you're muted. Please.
Yeah. First thing I would say is, we don't like a subject because we don't understand the subject well. So first, work on understanding the subject. The liking will automatically come. Try to understand what concept is being discussed, what they are trying to tell you, what is the understanding of the subject. So once you understand a subject, it is much easier to remember it also, retain it also. So first core is to understand what is being told, and then your automatically liking will come. And also sometimes you understand it is not about our likes and dislikes, right? It is also about the exam. So the exam tests you 19 subjects, you have to do 19 subjects. And if you're not literally understanding anything, you not have time for it, then you would do is a retrograde topic, high yield areas, previous year questions, right? And try to see that, and do it only for subjects that you can take a risk with. But try to see that you understand the subject. That should not be an exception. Whatever you're studying, if you don't understand, you will not be able to retain. Your liking will come with your understanding. At least when you don't feel, when you're literally in that scenario that you cannot take it up, do your high yield topics, previous year questions, last 3-year NEET PG and INS set papers of that subject, and hope that the topics, the routine topics will be asked.
Rahul, sir?
So definitely, when you're preparing for such a competitive exam, you cannot just leave certain subjects. You can even call it a short subject, whatever it is. Even if you have less time left, at least go through the core topics, because having a look at the previous 3-year papers might give you an overview of, okay, these are certain topics that I should focus on. So at least that topics, please, cover that. But I'm sure that, this is just July. And I think if you start now, if you start seriously, you will have enough time to finish your topics and also to do revision. But all depends on the quality time that you spend, because quality time means you cannot just, say that, okay, I'm studying for 10 hours, but maybe, you are always having a WhatsApp or a Telegram always active beside you. So always keep in mind the quality of time that you devote to studies and not just the quantity. Quantity, the time you devote is important, but so important is the quality of your studies, because you don't want too much of distraction. So you give yourself a good environment to study. Okay.
Rightly said, sir. So, sir, would you like to summarize a blueprint for all that we discussed today? Or should I be like adding to it? Or you can, sir, one of you can just summarize the key things here, and then I can, write down the key points and summarize it here.
So summarizing what we all three of us have discussed. First of all, see, you have around 6 months left. We assume the exam might be in Jan, but I think, I'm sure that it is not going to happen before that. So let's keep Jan as the date. And so you see how many months are in front of you. And then you write in your small diary, okay, now how am I going to go about it? Now, this depends on your strengths, and this depends on your weaknesses. If you have given the previous NEET PG, your analysis on where you have got to improve. Suppose you are joining a face-to-face or a TND or an online platform, whatever it is, have good clarity. That is number one. It's not like you start off, okay, let me start off with anatomy. Please have a good clarity, at least a rough outline on your next 6 months, and okay, approximately 2 revisions also. So that is the broad outline. So from there, you start with one resource, keep it as the primary resource, because we said not to focus too much on multiple resources. Now, focusing on one resource, remember, always have a good balance between your theory and MCQ practice. So read your topic well, practice questions from the Q bank. Yes, do subject-wise exam, but do give periodic grand test, because it will help you track your progress. Every 1 month, at least, just analyze yourself 1 month before and the position now, and see how you're going. Is the marks coming up in the GT? Is it static? If it is static, why is your mark static? We have already discussed that. So, and if there are certain minor corrections in the strategy, you can just make it, because at least for many students, you will have a phase of trial and error on, okay, how you want to plan your studies. So anyway, a comfortable environment, a good plan is very, very important. And it's always important to have a good, a circle also around you, whether you are in a hostel or you are at home. Always have a good circle. Don't attract too much of negativity. Okay, so that is, always worrying too much on the exam pattern, NEET PG, next, when is the exam? Please don't worry too much regarding that. Please live in the present. That is what we want to tell you. Don't jump to too much of multiple resources. Now, stick to your capabilities, because see, you have reached, you have done your MBBS, so you definitely, you're capable of cracking such a competitive exam. All you need is to trust yourself and the resource, your primary resource, and then, move ahead with that. So Sandeep sir, in case I've missed anything.
Nothing else, sir. You have mostly summarized everything. So whatever the key points you have been saying and whatever we have been also suggesting, I have summarized here as you were saying. So you should keep January 23 as the likely date, only because, not because it is going to happen, it may or may not happen at that time, but you can only work if you have a definite timeline in front of you. Secondly, you should define how much is the time available, what are my primary sources, from where am I going to read, what time I should be allocating. Make a workable plan. It may not be an ideal plan, but make a workable plan and then stick to it, and define the time during which you should be doing your first revision, first reading first. Then in each reading, in each subject, theory, focus theory, not cover to cover, but focus theory from your notes preferably, followed by MCQ practice or subject-wise test or QBank, whatever is feasible to you, and one grand test every month to see where your graph is going. And as Rahul sir very rightly said, avoid FOMO, avoid negative people, avoid rumor. I added avoid conspiracy theories. Every year, every exam, during preparation and especially before the exam, you will have conspiracy theories sprouting up all over Telegram. You will find maximum conspiracy theories, roaming around. Stay away from negativity. Focus on your preparation. If you know Dijot syndrome, if you know Down syndrome inside out, whatever the level of question, whatever, whether it is NEET PG or next, you will get through, you will get your answer correct. Remember, answer will be written there. Nobody's going to ask you to do a, karyotyping of a child. Actually, it will be there. You have to just identify and mark it there, and have positive people, positive family, positive friends around you to motivate yourself. Stay motivated, stay on focus. And Khaleel sir, anything else you would like to add, sir?
Yes, sir. As rightly said, it's very important to have a positive frame of mind throughout the preparation, believe that good things will happen, right? And it's important to have proper mentorship also. I think you should make time to find mentors you can speak to. It could be your family, it could be your friends, or it could be your teachers, right? We have JP sir so active on, in interacting with our students. Rahul sir is so active, and, you can always find and discuss with your strategy. It gives you a sense of relief and sense of, guidance throughout. So choosing mentorship is important. And also I feel, taking breaks, what happens is when you become monotonous in your preparation, it becomes stressful at times. So especially after a subject-wise exam or a grand test, after you have done the analysis of the grand test, I would suggest, to take a short break. It should not be an extended break, but maybe you go out, have a food at some restaurant, or, just take a break for an evening like that. So it's important to balance that thing. So stay in touch with people. Purely isolating yourself completely also not, gives you in that loop of, a vicious cycle of stress and negativity. So avoid that and try to do it in a very normal pace. Do it very happily. You can do this. You're doing it for yourself, right? Look at it as an opportunity rather than a fear, right? So just do it in a positive frame of mind and do this happily, guys. It's possible to do this smiling. This is possible to do it happily also. You are sitting in the library to be the better version of yourself. You're studying so hard to be the better version of yourself. So do it happily. Yes, sir.
Very rightly said, sir. Sir, can you just also throw some light, just a few lines on what does DocTutorial offer for me as a preparation portal? This is because we're taking it here because we are talking on DocTutorial's channel, and there are some certain things which students can find beneficial in case they are, in a dilemma. Sir, over to you.
So basically coming to DocTutorials as a platform, see, first thing I want to tell you is that the platform actually caters to different, categories of students. There will be some students looking to start off their preparation. They have not made any notes so far. You can definitely start with the lectures, which are, comprehensive but concise. So you can go through the DocTutorials app as your primary source. But, in case you have already gone for some other platform in your previous preparation and you're looking for more of MCQ practice and grand tests, there also you have the QBank, the test series, the grand test. And on top of that, I think the integrated MCQ discussion videos and the system-wise exam series. I think DocTutorials is very systematically doing these system-wise test series. So if you have already given your exam and your rank is reasonably okay, but not that good to get your dream branch, then I think, the system-wise test series, the integrated MCQ videos, all this will be highly beneficial. And I think as a resource, you can solely trust DocTutorials, which will definitely offer a 360-degree coverage. Because suppose you are learning a subject like pediatrics, You can watch Sandeep sir's lectures, then practice. Then you can, suppose if you are left with lesser time, you can watch the quick revision program. You can do the question bank. You can attempt the system-wise test series. So everything in one umbrella which is catering to all categories of students. It's not like, okay, this is a platform where only say toppers who will be able to finish all the lectures should join. No, I think depending on what your caliber is, I think you can select what is required, because we are offering everything. And not just that, it is not just an app where you have some lectures. Anytime you can reach out to any one of us and we'll be happy to help you, because all of us are active in social media as well. So any doubt, please get back to us for your queries. In the chat box of this or in the comment section of this video, we'll be sharing the link of the DocTutorials Facebook group, the Telegram channel, so that you can just interact with the faculty in case you have a doubt. Suppose you have a doubt while learning medicine, please feel free to post your doubts in the Facebook group of DocTutorials and then tag me. I'll be happy to help you. So that's it. This is a 360-degree coverage. That is what I want to tell you. Sandeep sir.
Just now, Himisha messaged me on Telegram asking, is Dhawan sir videos available? Yes, you should be typing it on the live chat. We'll be taking up live chat queries if you have any. Yes, your favorite ENT faculty, Dr. Rajeev Dhawan, is with DocTutorials now, and all his fresh videos, all his updated videos, the latest content, including the changes which have been asked, including the things asked in the recent NEET PG 2022 exam of ENT, have now been updated by Dr. Dhawan. So by Dr. Dhawan, it is available here. So just because somebody just asked me this query, so you should know that yes, Dhawan sir is with DocTutorials now. So that is an added advantage for you also. Along with that, all the eminent teachers are there. You can have a look at all the sample videos which are there, all the free videos which are available. And there are a lot other things which I would not like to say right now, because if we say and it gets delayed, it doesn't leave a very good taste in your mouth. But there is a lot more which is planned for you. And I hope not only the session, but the DocTutorials teachers, whatever they teach you, that helps you in your preparation. Khaleel sir, you would like to add something, sir?
Yes, sir. Like I really like some of the finest teachers. I personally, like the team that DocTutorials has built up. Some of the finest teachers are brought in together, and you can really enjoy the lectures, the hard copy notes, the colored notes, like everything that you need, and at a very, very competitive price that is being offered, and with very, very eminent faculties. And some of my favorite faculties are for different subjects. I really enjoy listening to them, and I'm sure that most of our students also would be very fond of the team that we have now. And it has everything that you need, guys: the test series, the leaderboard, the integrated questions. Right? It should be a one-stop solution, and you can always reach out to us for anything. And even the latest videos have been updated, and you will really enjoy the whole interaction that you will have with DocTutorials.
Thank you so much, sir. So it's an open house, like for the next 5-7 minutes. In case there are any queries, any personalized suggestion you want from your end, we are here. We can answer it live, or you can post it later in the comments also. But you can ask live to the faculties right now. So any questions, any comments? Khaleel sir, there are a couple of students who are FMG students, and they are asking. It's a NEET PG discussion, but sir, can you just tell them to contact you on the right portal so you can advise them?
We can plan a FMG discussion sometime later, sir, and you can communicate with me, and we'll have a discussion about how should you plan for your FMG in the next for your December 17th exam in a different timeline, sir.
See, because it's a NEET PG thing, so we are not going into FMG right now.
Yeah. You can communicate with me personally, and I'll guide you through, guys.
Dr. Somnath Jagdale is asking about, can you please explain the sources for each subject? Rahul sir?
See, what I want to tell you is in DocTutorials, suppose for a subject like, say, medicine. Now, when I teach you medicine, it's not that, okay, I'll teach you something, you then go back to your standard textbook. See, if you are preparing for the upcoming NEET PG, then let me tell you, just trust the video resources alone. because you don't have too much of time left to go for too much exhaustive reading from your textbook, then lectures. So it depends on what you are doing at this time. If you're a final MBBS student, yes, after the video lectures, you can go to the textbook. So what I want to tell you is, if you are preparing for NEET PG, just trust the video lectures, because all references in the video lectures will be from updated content in all standard textbook, but which are made actually simple. So I think the time you spend to read a particular topic, I think we'll be able to minimize it through our lectures. At the same time, if you are a prof student, you are a final MBBS student, you watch my lecture first, get the concepts correct, and then you can have a quick reading of Harrison. So that would be the ideal thing, and then start practicing questions from the question bank. So that is the ideal way forward, I think. So I think, as I told you earlier also, this is a one-stop solution. So just relying on one resource would be enough. You can go for your standard textbooks. Definitely, yes, it will be beneficial if you are doing your, say, final MBBS or you are in 4th year. You can definitely go back to your standard textbooks as well after the class. Okay.
Students are also asking if there is any custom subject subscription as it has been introduced for FMGE.
Well, we have got certain suggestions for that. Let's see, because as of now we have introduced it, we've announced it yesterday for the FMG, but just let us know your thoughts as well, in case you have an interest for that. We'll definitely take your feedbacks also on that.
And the overall pricing of the app is also very, very competitive, sir. I think, and the lot of teachers are good. I feel personally they should take up the whole pack, but if they are very selective, they can also go for this thing. I think we should come up with the clarity on the NEET PG combo offers soon, sir.
Yeah, all of you just go through the pricing of the app as well. You will find that the pricing is very competitive, but at the same time, we have not made any compromise on the quality of lectures or the hard copy notes or the Q bank or the test series. You can just download the app. What you can do is you can watch the sample video lectures, so that you will get an overall understanding. Okay, for every subject we have got sample lectures. So make sure you download the app and watch the sample video lectures. And once you feel, okay, I'm comfortable with these faculties, you can definitely join the course. Okay.
So I think most of the questions have been taken. So it was a wonderful session. It was a pleasure interacting with so many students through YouTube channel after such a long time. And it is again a pleasure to do such brainstorming, road mapping with such pioneers like Dr. Khaleel and Dr. Rahul. So I hope everyone benefits from it. End of the day, even if you do decide, even if you are not following DocTutorials, and suppose if you are still continuing with whatever material you are following right now, it is fine. But whatever advice we gave you, that is irrespective of the material. The suggestions we gave regarding GT, number of revisions, having a positive outlook, I think they are going to be relevant irrespective of the institute. End of the day, please remember that institute, teacher, motivator, everything is secondary. It is you, the person, who is going to decide your own destiny. It is in your hands how focused you are, how dedicated you are. And there are some more queries coming up. So let us just extend it for a couple of minutes more. Sir, any free GTs for non-premium users? One of the student is asking.
Yes, sir. I think we can plan this towards the closer to the exam date. We can have a common GTs, and it is always advisable to the students to give GTs from different platforms to have an analysis of varied audience that they are competing against. So I think we can discuss it and we can plan it towards the INA set and the NEET PG exam, sir. Or your suggestion, Rahul, sir? I think
definitely, we'll take that into consideration. And in fact, if you see, even last year also, we have conducted multiple such mock exams, and we'll definitely have a word with the management also. As always, we are open to your feedbacks, and whatever you have, as suggestions, please let us know also. We'll be happy to discuss among ourselves and also talk with the management. Okay.
So with this, we come to the end of the session. I hope everyone benefits from it. Thank you so much, Khaleel sir. Thank you so much, Rahul sir, for sparing your valuable time for all the students, for everybody. And thank you so much. This video again will go up on the YouTube channel. In case you have missed out or joined late, you can have a look at the points which were missed. And you can always get back to us, any of us, through our social media channels, through this video, comments itself, and we will definitely revert to you with the best possible advice we can give. So thank you very much. Keep preparing. God bless everyone. Thank you, sir.
Thank you, everyone. Thank you, Sandeep, sir. It was lovely discussing with all of you. Thank you so much.
Thank you, sir.